channel, Dr. Sickle. Today we are reviewing a common medical term, and this term is called anemia. I know you have had anemia, maybe not once or twice, or any of your relatives has suffered from anemia. It could be a child, it could be a spouse, or you yourself. And you did not get a clear picture of what anemia is and the causes, and probably what could be done if you are diagnosed with anemia. So stick around, stick with me, and let's just take a few minutes to understand what anemia is and then the common causes and how we can go about it. If you are very new to my channel, please subscribe, hit a bell icon so that you'll be notified every time I shoot or upload a new video. Thank you. What is anemia? Anemia is a condition in which the body produces inadequate amount of red blood cells or hemoglobin levels that are able to carry oxygen to the rest of the body tissues, and therefore the body suffers from chronic hypoxia and leading to the patient presenting with symptoms like general body weakness, dizziness, headache, palpitations, among other symptoms. Anemia affects both young and old, and pregnant mothers are affected most. Anemia can be acute and it can also be a chronic symptom. Anemia, or one can have anemia with mild symptoms or moderate symptoms, and we could also have severe cases of anemia. Anemia can be due to conditions like blood loss, which can be of various causes. For example, blood loss in women, which is following abnormal menstrual cycle, where a woman is bleeding more than 2 weeks and using about 4 pads a day. That is considered as heavy menstrual cycle, and it can predispose you to anemia. Number 2, we have a bleeding that is due to abortion. If somebody gets an incomplete abortion that is not attended to and managed very well, it can lead you to getting anemia. Number 3, you can have postpartum hemorrhage or bleeding after birth, and this one, if not managed very well, it can also lead you to anemia. Other causes can also be due to abnormal uterine bleeding, which can be as a result of hormonal imbalance. We could also be having abnormal bleeding due to uterine cancers, due to cervical cancers, and any woman who has bleeding of any unknown or identified cause, just know that if it's prolonged and chronic, it could predispose you to anemia, and therefore it must be attended to. We have other diseases that could lead to anemia. For example, bleeding, gastric ulcers. If they are chronic, they could predispose you to anemia. We also have cancers of the gut, which can also cause bleeding, and they can lead to anemia. We have bleeding from the hemorrhoids. Bleeding hemorrhoids can also cause you anemia. Hemorrhoids are piles that are found in the anal canal. They are as a result of constipation, and most times they tend to bleed due to chronic straining during process of passing stool, and they can actually cause you serious anemia. Other causes can be due to chronic diseases of the kidney. Chronic kidney disease can predispose you to anemia. We could also be having anemia that is as a result of chronic liver diseases. Other diseases that could also predispose someone to chronic or even acute anemia could be due to severe malaria. Malaria parasites feed on blood, and therefore when someone has severe malaria, they could have an acute blood loss and hemolysis of quite a number of red blood cells, which predispose them to anemia. Parasitic infections common in children, like hookworm infestation, could also predispose someone to chronic anemia. And other causes could be due to inadequate intake. Iron deficiency anemia is actually one of the most common causes of anemia. This is due to inadequate intake. Sometimes you're taking in enough but again you have malabsorption. So you could have iron deficiency anemia that is due to inadequate intake, but you could also have iron deficiency anemia that can be as a result of malabsorption. I talked about hookworm infestation in children, where the hookworms feed on blood, but they also attach on the intestinal walls and inhibit absorption of iron. All these can predispose someone to anemia. What are signs and symptoms of anemia? Signs and symptoms of anemia vary depending on the severity. But now let me talk about the severe cases. For anyone who is diagnosed to have anemia, that means their HB is way below the normal ranges. And symptoms may range from easy fatigability, like you get so tired quickly for small or simple activities. Number two, the body feels weak and you all the time want to be in bed. So you get body weakness. Number three, patients tend to get racing heartbeat. You find that you have very fast heart rate. Number four, some patients tend to have shortness of breath. They may have difficulty in breathing. Number five, some patients tend to have poor concentration. You find that you cannot concentrate for so long on some of the activities you're doing. You are easily irritable, especially the children. They tend to get irritable. They tend to be inactive when it comes to time for playing with their friends. A child who has anemia may tend to be wanting to sit down all the time. And then for the very young children that are breastfeeding, that have severe anemia, they tend to have to be very weak when it comes to feeding. You put the child on the breast milk, and therefore you see them struggling to suckle. They may sweat so much, and when you see a baby presenting with some of these symptoms, there is a likelihood that among other conditions, they could also have anemia. Now we have some of the examination findings when asked the health workers are examining a patient. When you have anemia, you tend to have what you call skin pallor. When somebody looks into the palms of your hands and maybe they compare with themselves, and this happens with us, the doctors. You find that a doctor looks in their palm, and then also they compare with your palm. So patients who have anemia, they tend to have pallor. Pallor can be for the skin, can be for the tongue, can be for the lips, can be for the conjunctiva. So patients present with pallor, and that pallor is seen in those organs. Another thing, then engorged carotid vessels and jugular vessels. You find that somebody who has anemia and they are already decompensating, their vessels tend to be enlarged and they are pulsating so much, like at a faster rate. And also you could easily see them pulsating so much. Thank you everyone that has been able to watch this video up to the end. I am believing that you found this video helpful, and please remember to like the video, remember to subscribe, share with a friend, and please turn up again and again to find new updates. Thank you.